Hello. It is, what are we at? Sunday, February 26th, 2023. It is 4 p.m. I am Delaware State Representative Paul Baumbach, and it is time for me to offer an update on the Delaware State Retiree Healthcare Benefit changes with proposed changes last year, what the current status is regarding future ones, and to try to field your questions. So that is what I'm aiming to do. I've been doing this for a number of, I guess, 4 times or so in recent weeks, and it's time for another one. So I'm sharing with my email address. That's not what I want to do. Let's try it again. Maybe that is what I want to do. There you go. There you go. So I have a YouTube page that has the recordings of the past ones in case you're interested in either viewing it or sharing it with others. I would suggest that the most recent one is probably the most useful one. So with that, what I'd like to do, let's see. So I'm going to give a little update on things and then see if there's some questions. I appreciate you joining me again. Representative Paul Baumbach, State Representative in Delaware for the 23rd House District, west and north side of Newark. So let's bring up a screen. I think that's a good one. Delaware has, for its state employees, promised healthcare benefits during retirement for decades and decades. Promises have been made forever, but setting money aside for it has really not happened. We've paid as we've gone along, but accounting rules have changed, and we in all states are required to recognize the magnitude of the future costs and the magnitude of the savings towards it, and any shortfall. And our shortfall is somewhere around $9 billion. That is a large amount and will take decades to address. A group was charged with looking into this about 3 years ago and came up with a set of recommendations that went to the State Employee Benefit Committee. The State Employee Benefit Committee early last year went ahead with a few of them, and the 2 biggest ones were setting aside 1% of the annual state budget just for this reserve. It's roughly $50 million a year, and the plan to do that indefinitely. And the second one, which is more impactful retirees, is changing the retirement plan, the health plan for retirees from a supplement, which in Delaware is the Medic-Fill program, to a Medicare Advantage program, custom made for Delaware by Highmark Blue Cross. And that was proposed, and a lot of outcry occurred, and this is a live session, yes, sorry. So a lot of anger came forward. Ultimately, a lawsuit was filed, and arguments were made, and a judge ordered that the plans be stopped in their tracks and that the current plan be continued for calendar 2023. So that's where we are right now. In addition, in late January, how to address this big shortfall. This is a slide that the Governor Carney's administration shared with legislators in January. There's really 3 different areas that can be adjusted to help fill that funding gap. One is to have the taxpayers pay for it, and one way is to have an annual amount go into it. We've begun that. We started that in July of 2022, and continue to do that. So we put it on the shoulders of taxpayers. We've begun that. We can affect current and future retirees, and there's many different, you can see 5 different bullet items of factors to address, to explore and consider. And the one that was chosen last year by the SCDC was migrating to Medicare Advantage, but there are certainly other choices in there available. And then also on the right column is we can put this, we can make savings and add to the fund for future retirees by making adjustments to what's available to active employees. And the last point here is that there's a survey that was sent out earlier this month to state employees to find out how they view a variety of both current and retirement benefits the state does or could offer. So, and again, yes, this is live. This is live as of Sunday, February 26th, 2023 at 4:06 p.m. So that was there. We had a bill passed into law, Senate Bill 29. That's not the one I want. That's the one I want. And it established, it changes the membership of the State Employee Benefit Committee, the SEBC, and it established a Retiree Health Benefits Advisory Subcommittee, our HBAS. And we'll go over the members of that in a minute. And it holds public meetings, and it looks at retiree health benefits for current and future retirees, including Medicare Advantage, but certainly not limited to that. And what does it do? It looks at the dollars that are involved from doing one choice or the other, and look at all the work that was done by the previous study committee, and look at all options really for how to address retiree health benefits, and then issue findings and recommendations to the governor and General Assembly by May 1st of this year, which is just we got 2 months, March and April, 2 months away. A very short time frame, and it's not that that's the end of the advisory subcommittee's work, but there's a requirement for the advisory subcommittee to produce something of what they have found at that point to the General Assembly and the governor. And the reason is that if there are recommendations that the General Assembly and the governor agree to, that gives us 2 months to put it into law and to pass it by June 30th when we adjourn for 6 months. That's the extent of Senate Bill 29. Again, there's other stuff done to the SEBC. What I want to point out is we now have some information on this advisory subcommittee. We've got all but one of the members have been named at this point. Some of this was set in the bill, and some of it is set by appointments that Senate Bill 29 set up. So it's chaired by our Lieutenant Governor Bethany Hall Long. I'm going to go down to the left column. I'm going to go through the top five first. The two co-vice chairs, myself, representing the House Democrats, Senator Brian Townsend is representing the Senate Democrats, and he's also the Senate Majority Leader. On the top right, we have Mike Ramone, who is representing the House Republicans, and he is also the Minority Leader there. And Senator Brian Pettyjohn, representing the Senate Republicans, and I believe he's the Minority Whip there. We also have three retirees. Two have been named. Wayne Emsley, I believe he represents retired school employees. David Craik, who I think has a financial background of some roles within state government in the past while he was working for the state. Another state retiree yet to be announced. And I'm going to get on the right column and then come back to the left. Then we have three representatives of state employee unions. One's for teachers, one's for municipal workers, and then one is for state troopers. So that's Jeff Tashner, Mike Bogato, and Bill Oberle. And Bill Oberle, I should mention, is a retired state representative. And then it has four other members who have their office, who are appointed based on their office. Seren Cade is the director of the Office of Management and Budget, so he's the budget guy for the governor, and so he's a member of the cabinet. Claire DeMatteis is Secretary of the Department of Human Resources, so she's in charge of all benefits for employees. So she is on there. And the last, I'm going to get back to Trinidad in a second. The fourth is Rick Eisenberger, the Secretary of the Department of Finance. So he worries about the dollars that are coming into the state and making sure that they are in the right magnitude to cover the dollars that go out. So those are the three cabinet secretaries. And then the fourth member, due to their office, is Trinidad Navarro. He's the insurance commissioner for the state, independently elected, doesn't answer to the governor. These 3 cabinet secretaries are appointed by the governor. They serve at the pleasure of the governor. We have a little independence from the insurance commissioner. The 4 representatives, elected members of the General Assembly from both chambers and both parties, answer to the voters, not to the governor. Lieutenant governor is independently elected, also does not serve at the pleasure of the governor. But these appointees were made by the governor of both, the 3 retirees were appointed by the governor. And then for the 3 representatives of the unions, one was appointed by the governor, one was appointed by the Senator Pro Tem, Senator David Sokola, and one by the Speaker of the House, Speaker Pete Schwarzkopf. So that's the makeup of this advisory subcommittee. There are no meetings yet announced. It is my guess that we will be meeting on Monday afternoons. It is my guess, I'll say it's an informed guess, that we'll be meeting 3 Mondays a month on the Mondays that the SCBC is not meeting. And the first meeting could be as early as March 6th, and if not, then March 13th. I believe the SCBC next meets on March 20th. So if you're interested in attending these meetings, at this point, you want to see if you can clear your schedules for likely Monday afternoon. We may have news of that in the next day, or what's today, Sunday, in the next day or two, as far as the first meeting or two. There is, let me see if I can get to, that's the page I need to get to. And there you go. So if you search on the SCBC, Delaware State Employee Benefit Committee, you'll come to this page, and you can find out about the Retiree Health Care Benefits Advisory Subcommittee. When you click that, you get the page I just shown you with the members on it. But it will. This is also where you will find meeting materials and agenda items and things like that. Extra meeting on March 6th, meeting on the 6th and 20th. Okay, so Jim, thank you for that. That's good to know. Yeah, I'm jumping around, but I see some comments, so let me get to them. Okay, yes, indeed, this is a live thing. So, Joe, at the beginning, you showed the slide that included options for retirees. Where does it say original Medicare plus supplement? So let me pull that up, and where we want to go? We want to go to Adobe, and we want to go to that one. Okay, so Jones says, where does it talk about maintaining a supplement? And that is Medicare Advantage. Well, I'd say that would be maybe the 3rd bullet. You can have 2 choices: Medicare Advantage or a supplement plan with different premiums. Would be what I would look at, the original Medicare plus supplement. So I think it's within this. Keep in mind, this is what the administration was presenting in January. The advisory subcommittee can go where it wants to go. So it is, we can certainly go beyond this slide. This is just a slide that the administration shared with us in January. Was that supposed to be traditional Medicare plus supplement? Yeah, I believe that this supplement plan here in this bullet is meant to describe something like the current MedicFill, a traditional supplement to traditional Medicare, as opposed to Medicare Advantage, which is a newfangled version of things. David Craig, Mark, thank you for. I knew it was tied to finances in the state government before, so he was previously the director of Office of Pensions, as reported by Mark. And that sounds right. I knew I'd encountered him in the past in a position like that. And then Joan points out the SCBC is already has added a 2nd meeting in March, on March 6th, so we may have to dance around that. That would make it more likely that we'll be meeting on the 13th and 27th. That's just my current guess. And then hopefully we can get 3 meetings in April, and in those 5 meetings have gleaned enough, learned enough, and maybe come to some consensus on making recommendations. So that's the current questions in there. I want to now look at this guy here. A lot has been raised about the current proposed budget, which is in, I don't even know what the heck, page 149, let's say. This is House Bill 75, 149. So 101 is, do you love these really long things? Here we go, HR. Okay, 101. So section 101 is really, really small, notwithstanding any provisions of the law to the contrary. Okay. Division of Human Resources continue its efforts towards implementing 5202 D4 and D5. That has to do with when you've got two members of a couple, each of whom is a past state employee, and how you handle their health benefits. This section does include, I think, 4 to 6 references to Medicare Advantage, but I think the more important clause as it relates to Medicare Advantage is this last one, which is that the Department of Human Resources will work within the terms of the 2021 Medical Third-Party Administrator RFP, that's a request for proposal, and executed contracts. So I read this to say that in the governor's recommended budget, he is building in his recommendation that Delaware works towards implementing what the judge stopped, which is a Medicare Advantage custom plan for Delaware. Now, let me be really clear about how these budgets work. Budgets are recommended by the governor on the last Thursday of January. Then the legislature has 5 months to go over line by line, public meetings, what's in the budget, and to say, we like this, keep that. We want to build on this one, do more there. We hate this, pull it out. So the fact that it's in here does not mean it will be in here on June 30th when the budget is passed. This is what the governor is recommending. The budget has to be comprehensive. It has to, therefore, address how the state for the next 12 months, starting July 1st, will meet its responsibilities, including its responsibilities to provide health care to our state retirees. This is what the governor is recommending. And part of when the governor recommends this part, tied to that is the cost for doing what is written in the budget is factored in and is charted as this is what the state will spend for that. If there's changes to this, we in the legislature are certainly welcome to make any changes we want, to the extent that that brings a higher cost. So if we don't do this and we just continue Medic-Fill for the 12 months starting July 1st, and that costs an extra $7 million a month, $8 million a month, maybe an extra $100 million a year, we need to make sure that we've got $100 million from the budget that moves from someplace else into this change, into the cost of this change. So it's, yes, we can strike the lines or we can modify the lines, but if there's financial implications to that, we need to, we being the Joint Finance Committee, which is the group of legislators who work on reviewing every line of the budget and coming out with any adjustments that they feel is appropriate, using the governor's recommended budget as the base. They will also need to worry about where the dollars go for any changes. Okay, so I think that this is exactly vote has the right to override that vote concerning healthcare. So what the governor included in the epilogue language can be struck. So no matter what the heck is said here on lines 1 through 3 of page 149 of House Bill 75, the legislature has the right to strike that entire thing. So that is not a done deal. It's not set in stone. It is part of the governor's recommended budget. It is what he was recommending in January. It is in the base that the Joint Finance Committee is looking at. Joint Finance Committee has full authority to make whatever changes it deems appropriate. Final package then comes to both the House and the Senate. And with majority vote, we can pass the budget. The governor certainly has the right to veto any budget that comes to his desk. We have the right to override if we have enough votes, or we can come up with an alternate budget. So as far as can the governor override the vote regarding the health care. No matter what the legislators vote, he has the right to override that vote concerning our health care. No, that's not accurate. Yes, I know that phrase of notwithstanding any provision of the law to the contrary is troublesome on its face, but that is merely in the January version of the budget. What matters is the version of the budget that becomes law. And this is not law. This is just a bill. Okay, Joan, if my reading of that slide is correct, then there's no option being given for keeping retirees on original Medicare plus supplement, period. The only place a supplement plan is mentioned, it's an alternative. Jen, I want to state again, this is just a slide. This is just a slide. This is a presentation made by the administration to the legislature. This has no weight of law. This has no weight of regulations. This is a communication piece. It has no standing. It is something that the administration put together to communicate with the legislature of what it views as being things that had been considered by the RBSC, the Retirement Benefit Study Committee. It does not limit the legislature for what it can be considering going forward. Really, what limits that is Senate Bill 51 and the subcommittee and what it's to do. And this is where, and if this is just an advisory subcommittee. So advisory subcommittee may even be written in a way that limits things. There is nothing that stops the Delaware legislature from passing laws. Obviously, a governor's veto can stop a bill that's passed, can be overridden or rewritten to a way that doesn't get overridden. I was on a Zoom earlier today, and one of the things I mentioned is this advisory subcommittee, which has 4 hopefully well-placed legislators on it. This advisory subcommittee may find, here we go. So you can see there are 4 legislators on this. We may find, whether a majority of the subcommittee agrees, we amongst the 4 of us may say, it is clear to us that we should never make any changes for current retirees, as an example. And then we can, as the legislature, produce a bill that limits the right of the SEBC, the power and the authority of the SEBC to change the retirement benefits for current retirees. We can grandfather them to the same structure, whatever wording we put in there. Nothing in Senate Bill 51 changes that. Nothing in the budget changes that. The legislature has the power to pass laws of that nature as it wishes. Has enough votes, can pass those bills. And if we pass the bill and goes to the governor can choose to sign it or veto it. If it's vetoed, the legislature has the right to strive to override the veto. I think too much is read into this 3 lines, that 3 lines from the recommended budget. The legislature can do much more. And I think that my colleagues in the legislature are waiting to hear from the work of the subcommittee and the work of the 4 legislators on that subcommittee, and to see whether there is some consensus on either where the state should go or where the state should avoid going regarding retiree health care. So let me read through the questions. So I hope, Joan, that addresses your one question. No consideration is being given to promise on which retirees rely. Actually, I want to make sure I don't want to skip any messages. Okay, we did the passage. Okay, Joan, if your reading of that slide is correct, then there's no option being given to address that. The only place supplemental plan is mentioned, it's an alternative and have different costs to retirees. Okay, yes. So no consideration is being given to the promises on which retirees rely. Great question, Joan. How is the state of Delaware bound to the promises that were made to retirees. I've asked this of some senior administration officials, and I had an interesting response given. There is, what is the legal, how's the state legally bound to our retirees? And the second is, how is the state morally bound to our retirees? As I understand it, our being legally bound is less restrictive than morally bound. So I hope that makes some sense. We can say that it would be a challenge to convince elected officials in charge of the state of Delaware to renege on verbal promises, verbal representations made to retirees. But it doesn't mean that that would be, if the state of Delaware chose to do that, that a court would override that decision. Because I don't believe there is strong legal prohibition against the state changing the retiree health configuration of benefits to state retirees. But whether it's legally possible is different from whether it is whether it would be done, because it may be politically and popularly extremely unpopular. So I'd say there's no question consideration is being given to the promises made to retirees. I'll say it explicitly. This advisory subcommittee has its meetings open to the public. There's public comment opportunities given. I would imagine that point will certainly be raised and considered by the subcommittee. Does the governor have a line item veto for the budget? No. It's an all or nothing. So Pat, good question. The governor, when we pass a budget and it's hundreds of pages long, as you can see, it's a take it or leave it. When we pass it in both chambers, it goes to the governor. He can either veto the whole thing or he can sign it and pass the whole thing. That said, and we had, was it a veto? I don't think it was a vetoed budget, but it was a budget we couldn't pass. And it had to do more of the two parties couldn't agree on some issues. And it's not that we rewrote it, but through some negotiation, we figured out if we change these small pieces, we can satisfy both sides enough that we can get it passed. But the process is we pass bills, they go to the governor. He either signs them so they're all become law, or he vetoes them so none of it becomes law. And anything that's vetoed, we have the ability as a legislature to consider an override. Okay, so Joan asks, it has no weight of law, but the administration is telling the legislature the original Medicare plus a supplement with MA out of the picture is not even being considered. So Joan, again, that slide that we're referring to, that's not the one. The slide that we were referring to, that one there. This is, let's look at the top line here. Considerations by the Retirement Benefit Study Committee. That is not the current advisory committee. That's the past one. This is no longer constituted. It doesn't exist anymore. They said that study committee looked at this. Okay, so no, it's having original Medicare plus a supplement with MA out of the picture is not even being considered. That is not factual. That is the RBSC, as presented by the administration. This summary of what it didn't look at that. It absolutely does not mean that the new Retiree Health Benefit Advisory Subcommittee cannot look at that. So that's there. Would the administration like it to be considered or not? I don't know. I am not in the minds of the administration. Okay, so Andrea, I hope I'm reading that, pronouncing it correctly. A concern with the governor appointing people to be on the subcommittee. Some of those people wrote letters of support to the governor for Medicare Advantage, and there's a couple of names that voted last year to approve the retirees' Medicare Advantage. Absolutely, I can't disagree with that. The bill was written so that the governor has appointments, the senator pro tem has appointments, the has appointments, the Speaker of the House has appointments. Some of these individuals either report to the governor or were appointed by the governor and had taken a public position regarding the Medicare Advantage plan that was proposed by the SEDC and was put into place to become effective on January 1st and was stopped by a judge. So I do not mean to imply that this advisory subcommittee is, I'll say, it's not like a jury that comes in having been, anyone who had an existing bias was prohibited from serving on it. No, people, the members of this committee come with the baggage that they have. I've got baggage. Every member on here has baggage. And I imagine, Andrea, that you are pointing out that you are concerned that some members may not take new information into consideration to the level that you would like based on their past positions. I understand that concern. And that's just a half hour, but I'm not seeing any. There we go. Good. Okay. So the plan that comes out of this committee, a majority approved plan. Okay. So, Andrew, thank you for letting me know that I'm reading your question accurately. So, Lynn, so what comes out of this committee is a recommendation to the legislature and to the governor. And until this committee meets and comes up with that status, that report, I cannot say. CAT is indeed issuing a minority report at the time. Is it a majority approved plan? I believe here's what I would expect, having served on past task forces. When you have a committee like this that is charged with producing recommendations, if I was the chair, I would be working on the timeline and making sure that we were moving towards getting a report that could be handed off in the time by May 1st. And I would strive to have it be one, I would insist that it be one that has support of a majority of the voting members of the committee. So, and that means, I don't mean this in a really negative way, that means that it may have to get watered down in order to gain enough votes that it has supported the majority of the committee. That does not stop. It's very uncommon for there to be a minority view, sort of like in Supreme Court, the majority issues its findings, and those who were outvoted sometimes will issue a minority opinion. I don't think there's anything structurally that prohibits that. It's not common practice. But I think, again, what I'd say is the bill set up this advisory subcommittee, and it has an ongoing obligation to look at these choices until we've addressed this issue. It is responsible to report back to the governor and the General Assembly. Of course, the governor, his people essentially run the SEDC, so the SEDC is inherently informed by these recommendations from the advisory subcommittee. What comes out of there is, the advisory subcommittee gets a majority. Whatever comes out with majority may be this far. It may be that all four legislators wish that there was a stronger recommendation, more detailed recommendation, but we couldn't get a majority of members in support of it. But if enough of us say, we think this is a good idea, we'll talk to our legislative colleagues, and we may have no problem getting plenty of votes to have that adopted as a bill, introduced as a bill, passed as a bill, and we can work with the administration to see if we can get it signed into law, or if not, if we have enough votes for an override. So the advisory subcommittee is just advisory. It is not the only thing that can be done. I do believe that my colleagues are in a holding pattern on this topic. They want the advisory subcommittee to run its course for the next 2 months, to have these meetings, to dig deep into these issues, come up with whatever recommendations that we can as the majority of that advisory subcommittee, share that with the General Assembly, but also have conversations and say, here's what we're finding, we're hearing this, we really like to avoid that, we're hearing this, we sort of like the sound of that. And maybe we can just collaboratively with the administration say, let's move in that direction. Or we may say, we want an assurance that we don't get what happened last year, and we're going to put things in law to put in guideline, that's the right term for it, sort of lane markers to make sure that the SEBC goes in a particular direction, that the legislators on the subcommittee, along with their legislative colleagues, agree really has to happen, and we want to restrict the freedom of the SEBC to do sort of a wider range of whatever they wish. So that would be my take there. I do think we've got, as I've been saying in emails the past week, I think we're in the first inning. I know that Section 101 has upset a lot of people, and I get it, I really do. But I think that the level of anxiety about that section would be appropriate if that was in a past budget. It is not. It's in a proposed budget, a January budget, not a June budget. So, and that's something that I have the perspective of as a legislator. I've gone through this now for the 11th year. I see budgets change an awful lot between January and June. So I think we've got that ability. And from speaking to some of my colleagues on the Joint Finance Committee, that Section 101 is not viewed as untouchable in any stretch. So, it may be the Joint Finance Committee, maybe some of the members will issue some statements about that. But in my conversations, those three lines are going to be very closely studied, and I just leave it so they'll be closely studied. We'll see what happens there. Okay, Andrea, Paul, since now the state has always funded 20% of our health care, the question is, why would the state think we would be okay? State think it would be okay them controlling 100%. It's always funded 20% of our health care. Why do they? We don't want them touching our Medicare. I think it's. Let me answer a parallel question. Does the administration understand that a sizable number of Delaware state retirees do not want Medicare Advantage? I think the answer is yes. Doesn't mean they won't be proposing it and trying to make it happen, but I don't think that. I think that the administration, just as legislators, got the message that the forced change without choices to Medicare Advantage is not popular. And we have the employee survey. We'll see what it brings forward, but all of the outcry of the past 6 months was heard. And so I don't think I need to go further than that. So I'll just leave that there. Any more questions? I'm personally, things are background's different. I'm getting surgery on Friday, which is why I moved my home office downstairs to the ground floor, which is why I don't see flags in the background and such. It also means I probably won't be providing this next weekend. I'll probably be deeply recovering, hopefully getting pain meds out of my system and things like that. I will probably be in 2 weeks. I will post on Facebook both this video. This will be stored in Facebook, stored on YouTube. As news comes out about meetings of the advisory subcommittee, I will ensure that I get that message out in Facebook. I will try to get e-blasts and email blasts out. That you can go to my webpage by following me, or I think it's called sign up or something like that. You can sign up to get all my e-blasts. You can always send me an email at the address given at the top here, if you and ask to be added to the email list. I hope that helps. I want to answer Pat's question. By the way, thank you for these questions. They make this much more interesting in my eyes. Has subcommittee seen the employee survey questions, many of which pitted current employees against retirees? So, Pat, thank you for that. I'm a state employee. Every legislator, including the 4 on this committee, has, if they completed the survey, had seen them. I went through them and I did some screen captures because there were some that I had some questions about. And so your point is, I'm reading into it that you were displeased that some of the questions you felt were very clearly pitting current retirees against future retirees, and you felt that was unduly antagonistic, perhaps. What I point out is that, okay, it sounds like I'm defending the survey. In some ways, I am. Now that said, I also pushed back with those who designed it. So I had some problems with it. So it's not like I didn't create it. It's not created the way I would have. But I think that it's important to do things where you're pushing questions of uncomfortable choice A or uncomfortable choice B. And that is important because with a $8-9 billion hole, to address that, we're going to need to make uncomfortable changes. So I think it is important to figure out, I don't like this. I don't like this decrease in benefits, but I dislike that less than I dislike this decrease in a different benefit that I value more highly. So maybe I'm willing to pay some money towards a premium to get traditional Medicaid, as opposed to having no choice and being forced into Medicare Advantage with no change in my no premium cost to it. Those questions are appropriate in my eyes in the survey. The pitting one against each other, well, frankly, I think there's been a lot of retirees who point out, why can't you just grandfather us? And because we've worked for 30 years and we were promised this, and I don't want you to change it for us. We're already retired. We based our retirement on these promises. Why would you change it? And maybe new retirees, you can make some change for them. Well, that's pitting one against the other. Frankly, you can't avoid that as far as considering, should we have something that grandfathers? Should we have something that treats current retirees differently than those who haven't retired yet, who have a chance to make some adjustments in their plans before making that decision of retiring now with this dependable provision of retiree health benefits. Again, I think there's strengths and weaknesses in the survey. As I understand, it's a dynamic survey, so that my series of 30 questions is different from anyone else's, because how I answered the first 3 would affect what my 4th question was going to be, and so on and so on. And that's a good design. But again, I had some problems with it, but I didn't have a problem with it asking uncomfortable questions, because we're going to need to make uncomfortable choices. We just do. You can't solve an $8 or $9 billion hole without having some uncomfort there. Let me see. Did you see that? Okay, thank you, Pat. Unfortunately, the only way to review the questions was through screen captures. Pat, I'm 100% with you. I got mine from an unnamed present employee. Yep, understood. However, there seemed to be little space to say none of the above. Pat, you're absolutely right. It was a lot of surveys. Well, okay. I'm sorry. Pat's point is, there were several questions where you would have liked to be able to say none of the above. This is what I would have preferred and why. and that just wasn't there. The challenge is you want a survey to be actionable, and for it to be actionable, you need a good number of people to answer it, and you need enough of those people who answer it to actually answer it. And if everyone's doing the none of the above, then you don't have enough data on each question to say this is a clear view of the survey people. So you want to have a broad enough set of answers that people can be comfortable choosing at least one, choosing one of them, comfortable enough choosing one of them. I don't think they hit the mark on every question, as you're pointing out, Pat. But it's also one where if the survey just for every question had a none of the above, put your own answer in, it would not have achieved the goal of getting more actionable statistics from that. Okay. Okay. Okay, so Andrea, there's a major problem with that survey because a 20-something person is definitely going to want to save money, whereas a person who's in their 50s and getting ready to retire and has family who are in college, they're going to need those benefits. And Andrea, this is absolutely factual. You're completely right, and that's one of the challenges. We have 20-year-olds, and I'm going to generalize, and I apologize in advance. We have 20-year-olds who they want to have benefits. They may want to have, family benefits for if they have children, if they're about to have children. They may want to have something to help pay off college costs. That may not be a concern for any 50-year-old employee or 80-year-old retiree. So if you take a 20-year-old or a 23-year-old and a 53-year-old and an 83-year-old, very different priorities. And that's one of the big challenges of the SEBC, the State Employee Benefit Committee, is they have a wide range of people that they are looking out for. And it's a wide range of priorities. And that's where a survey like this, if it's representative enough, we can say, well, those who are 20 to 32 feel really strongly in this way, and those who are 32 to 41 are this way, and et cetera, et cetera. That's really important data to have. And we also need to know our numbers. If we happen to have more retirees than current employees, we need to weight that. And we need to realize that we need to really be extremely sensitive because there's so many retirees. If there's only 10 retirees and 5,000 active employees, we can worry a little less, or maybe it doesn't cost much. And anyway, indeed, we have different pots, different groups of people the survey went to, and I believe their demographics are going to be in there. We can say, okay, this is an age group that has this kind of common factors in their answers, common threads in their answers, and this is a different age group that has different threads in there. I think that's good information. Okay, that was Andrea. In an appropriate survey, there would always be another choice. Jane, I understand, and I know that taking it, I'd feel better if I had that choice, if I had that, an other choice everywhere. But if you give that, you're not going to get, in many questions, you may not get enough answers to be able to figure out, do people prefer to have a tuition reimbursement or a college loan payoff or a match on your 403B plan? And those are things that we need concrete answers for. So to restrict the number of answers, you're forcing the results to have enough data to give you an answer. So on some of this A or B or C kind of thing. I know filling out surveys, if I have time, I'd much rather have the opportunity to expand. But there's a downside to that, and that the people who created the survey, both the state agency and the contractor, came up with this structure. Again, the last comment, many of the people who took the survey were extremely upset when they saw spousal coverage knocked down 50%. Okay, the spousal coverage knocked down 50%. It's a survey of hypotheticals. This is not knocking down spousal coverage to 50%. The survey is asking, would you prefer, if in these hypotheticals, would you like or dislike more option A or option B? And in many cases, frankly, I think the better examples are option A takes something away, option B takes something different away. Which one do you like more? Which one do you dislike less? And that's that's what the survey was designed to do, is to find out where people were on that. And it's not saying you're going to get A or B and your answer there, it means you're going to get it. It's saying this is a survey giving you hypotheticals, and we're trying to find out which factors you care most about. Again, I had notable complaints personally on this, and I shared them. But I don't think it means the issue that some objectionable options were presented in the survey. I think it was misinterpreted by some people, taking it as saying that they were approving something awful. No, this is a survey that was looking at different hypotheticals, saying which sets of choices, column A or column B, do you dislike the least? That's, I think, the best way to view it. And I think in that way, you might be a little less upset by the phrasing of it. Terry, sorry, let me make sure I got it back. But I'll get to it. I want to make sure I'm getting from the top down, or I'm going to lose some stuff. 50%, get that. Lynn, point is, it's got to be changed. There's no chance to keep what we have, so they're going to choose what they believe are the lesser of the evils. That's that. Lynn, agree. We have a $9 billion hole. We are not going to fill it without a lot of work. And work can come in reducing benefits, increasing costs for the same benefits, bad things. So that's that is sad. Yes. Okay, Terry. In this case, weren't only the 20-somethings and the 50-somethings given a voice? Retirees got no survey. Terry, I think you're right on that, and it is a good point. But I think as long as those who are consuming the results of the survey are sensible, they're going to say this is the voice of the current employees. That's nice. That's a subset of those who are affected by the decisions, the policies that we're considering. So I think there would have been value to also surveying retirees. I believe that I don't know, because this is back from the RBSC before I was on it. I think the recommendations was to survey the employees. I don't know why that was the only. I think that was in the recommendation. Let me see if I can find that. There's the initial report. I'm going to bring it up on the screen. There we go. Okay, that's what I think it is. Current recommendations: increase one time, reviewing transition, develop plan, reduce subsidies, eligibility, eliminate access. Okay, nothing more there. Let's go for the March one. I thought they had the survey in here. Recommendations, add dollars, Medicare Advantage, look at other things, specific changes, reliability. Survey and focus groups have conducted. Following completion of the survey, let's go to the top and let's search for survey. Survey groups, developing and planning plans, if feasible, with active employees this year. So the SCBC, in its March 2022 recommendation, recommended a survey of active employees. I don't know. I wasn't on the committee back then, but they that was their suggestion, and that's where they went. I agree. It would also be useful to find out for various things that we're considering, various unpleasant column A, unpleasant column B, which is more unpleasant for retirees. I think that would also be useful. Okay, other choice. Here we go. Okay, sorry. Major problem. Choices. Right. Okay. So Andrea. Many state workers think the majority of the survey will control the outcome. Oh, okay. Interesting, Andrea. Thank you. So I think, frankly, I don't know how this advisory subcommittee is going to operate. It's going to be drinking out of a fire hose. There's so much information, so much in the way of inputs. so many different sources, and we're going to need to figure out, frankly, which sources we have the greatest trust in. Um, and we're going to need to understand the context of all inputs. And one of the contexts is the survey. The survey is for active employees. It is not the voice of everyone affected by these decisions. So, if we didn't survey the taxpayers, who one of the things I think we're considering is, well, I personally am considering, is having a greater proportion of the annual budget go towards filling this $8 billion hole, $8 to $9 billion hole. And we haven't surveyed the taxpayers. I think it's important for the subcommittee as a body and individually to be looking at all the inputs and the contexts that each of those inputs come from. Pat, good points with sufficient input on the survey. However, none of the current employees I spoke to even knew the survey was out. It's also a strategy. I will say, Pat, I don't know. I don't work in an office with a whole bunch of other state employees that I ask about. It came out in February. The legislature's been in recess while the Joint Finance Committee does its work. So I've not been interacting day to day with state employees to find out, did they get the survey? Are they doing the survey? I believe I got at least 2 emails about it, and I ignored the first one, and I got to the second one and did it. And it took 20 minutes, something like that. I did some screen captures. It took a little extra time as I was getting frustrated at the wording of this choice or that choice. But we'll find out. Part of the survey results will be, we sent this out and invited, 25,000 people, and we got 25 answers. Okay, that's a problem. But if we, send it out and we got an 8% or 10% or something like that return rate, that's probably a good one. I don't do surveys, so I'm going to need to find out from those who do what a good response rate is, and we'll go from there. Mark, younger individuals are not exactly flooding into state employment. Mark, great point. It really is a challenge when we have different groups of individuals who are affected by these decisions. As I said, the younger employees, when they're looking for a job, sometimes they're just looking for the salary. And they're not really worrying about that 40 years from now retirement benefit. And they may not be worrying about that retirement savings part of it. They want to get the salary because that's what they're comparing to their other options. We're in a low unemployment period now where employers, including the state, have to really fight to get employees to come in. And the state has both strengths and weaknesses. And one of its historic strengths is a good retirement system, including retiree health system. And if we gut that, and I'm not saying, well, some people would say Medicare Advantage would gut that, to the extent that we weaken it, that weakens one of our strengths as an employer in a competitive employment market. However, that strength is felt more anecdotally by older employees than younger employees. So if our challenge is landing more younger employees, then as the survey showed, attention is being paid to other benefits that younger employees may find more valuable to them in making their decisions of whether to start with the state or stay with the state. All right, Joan, if a survey of the retirees was constructed the way this one was, would you rather have no coverage for X or no coverage for Y? It would make things worse than they already are. I'm not really sure of what that question is. No coverage, it make things so. Gosh. I'm not part of the executive branch, so I'm not part of administering our state government. I'm legislative branch. We make the laws. If my input was requested for a survey, I would provide it. And part of it's not just the content of the survey, but also how it's packaged, how it's presented, what goes along with it, and explaining what its context is, how it's to be used, etc. If you just send a survey out, and I'm going to generalize and say a retiree by definition is older, and it may not have a lot of experience in recent surveys of these natures, but I would explain we're going to give you, before you do your first question, these questions are going to stick. They're going to be saying, would you rather lose your left leg or your right arm? And of course, you don't want either. And answering one of them, and you're being forced to answer one of them, doesn't mean you want to lose your left leg. Okay? But we're trying to figure out whether you like your arms or your legs better. And I'm using that as an analogy, obviously. That is useful, and that's how surveys of this nature are designed, and that is how they actually provide useful insight. But just throwing a survey at you, especially if you're a retiree and maybe advanced in years, that without some accompanying context, that can be very alarming. So I think that's what you're getting at, Joan. Okay, Andrea asks, can I address that on the state website, they have a pamphlet that alluded to, it keeps jumping around, sorry, that they're moving forward with Medicare Advantage. We spoke about that on Friday. Andrea, can you share with me the link that you're speaking of, and I can look into that. Who will the survey results be provided to? So I believe, if I remember correctly, I believe the survey was instituted by the SCBC. So I would imagine that the results will be presented at an upcoming SCBC public meeting, both verbally and very specifically. I would imagine it'd be one of the files in the meeting materials. So I think that will all become public. Check my email. Oh, I'm sorry. I got you now. Late Friday night. I'm going to go searching for that in a minute. Joan, retirees are already upset because there already has been an attempt to change their benefits. True. That's already happened. The attempt, yes, is unhypothetical in the current climate. If a survey went out suggesting that there's no intention of maintaining original Medicare with supplement, and what else would we prefer? At least some people are not going to react well. That's true. Now, yes, that's true. Additionally, I would like to think that the state would recognize that, Joan, and say, understandably, the recipients of the survey are already on pins and needles and are extremely sensitive to this issue of losing health benefits. So it is incumbent upon us to message this very well and provide full context. And also, I hope that people like me, elected officials, help in getting that message out of what the context of this survey to retirees, this hypothetical future survey to retirees is, to help prepare people before they get that first question and get very upset. And for that matter, I mean, I'd like to see groups like RISE also help with get the message out of saying, this survey is coming out. We had somebody jump on it, and they told us that at first blush, it stinks. But here's the reason it stinks. It's making you choose between losing your left leg or your right arm. And it is not that the state's planning to take your left leg or your right arm, but the state is looking at a whole lot of options. And the survey is phrased in a way of asking you to choose between two unrelated sets of unpleasant changes. And the state's doing that to strive to minimize the discomfort of the changes that have to be made as a collection to, over many, many years, address a big shortfall. And again, this is not on RISE's shoulder. They're not responsible for this, but they're positioned for that, as are elected officials, although we're responsible for it. And also we're well positioned to help with that messaging. And very much the owners of the survey, SCBC in this case, is responsible and also well positioned to only send it out along with great collateral material that helps those before they look at the first question to understand where that question is coming from and why it's phrased in the way it is. Okay, now I'm going to go searching. I'm already off there. Good. Okay. I like talking to myself. I appreciate no one questioning that. Okay, inbox and Lynn, yes, I would love to disagree with you, and no, I cannot. Let me look at my Friday evening emails. Andrea, I do not see what you're referring to. If you can please resend that, and I'll again put here again my email address, and then I'll respond to you directly there. Okay, Pat, they're well positioned, but not necessarily well inclined to get the most answers rather than their favorite answers. That goes all the way back to the first meeting at Goldie Beacom. And Pat, I'm not sure who the they is that you're referring to. Maybe SEBC. Not well inclined to get the most answers rather than their favorite answers. Okay. This is something I feel very strongly about. I will SBC. Thank you. I will never, and I suggest that others never presume others' motivations. I'm happy to criticize people's actions, but I will not criticize somebody based on what I think are their motivations. Actions, quite fair game, quite appropriate game to criticize. With that, I will not join in any criticism of SEBC's members of SEBC's motivations for things. What's their favorite answers? I think it's fair to say. I mean, I know some of the members of SEBC. I think it's fair to say that do they have favorite answers? Well, I mean, frankly, let me start at home. Do I have favorite answers here? When I look at those three columns, I'm a numbers guy. I think that we should have the lion's share of the changes to address the shortfall to fall on the taxpayers. Currently, we're putting 1% of the budget towards that for every year in the future. I think that if we do more, I know that if we do more, that we'll close more of that hole and have to do fewer changes for current employees and current and future retirees. So yes, I have a predisposition. I would imagine any SEBC member who's been on the SEBC for a period of years knows the problem pretty well, probably has some of their preferred approaches. If I'm a cabinet secretary and I report to the governor, and the governor may also have his own preferred solutions, and if I'm reporting to him, I may prefer that. But I do believe, and I'm going to believe the best of people. I believe that members of the SEBC want to know where employees are regarding which of his set of benefits matter the most. And if there's some that they've had forever but no one cares about, they'll take that away and save some money, and rather than cut some other stuff that's really important to people. So, I mean, I do think that there's a sincere desire on the parts of the members of the SEBC to get accurate information from current employees and perhaps in the future from retirees on this. So we'll see. For whatever reason, I'm looking at everything, not seeing any new email. But Andrea, when I get that, I will respond to you. Info House Dems. Okay, good. I'm glad I didn't lose it. So info House Dems. Someone will get to it. It's the weekend. They'll get to it tomorrow. But I'm glad I didn't drop it. I feel better there. Besides the change in benefits, the other thing that has been lost in this is goodwill. Oh my gosh, isn't that the truth? And lost trust in the state. Pat, completely agree. Completely agree. Most people saw the original pamphlet and said, okay, the state has always looked out for me, so I'm in. Yeah. I agree, Pat. I think credibility is something that you build up over years and you can lose in seconds. And I think that for retirees, really for retirees, there's been an awful lot of credibility and trust that has been absolutely lost in state government, in SCBC, those kind of decisions, the administration, because of what we went through last year. So yeah, I get that. And I can't change. We can't change the past. I will do my part to try to build trust in the process that the advisory subcommittee goes through. I want to make sure it's open. I want to make sure how we are looking at things is broad and not narrow and not predetermined. And I want us to be clear about how we make decisions. And I want to make sure that we give an opportunity for people to share what things that haven't been shared yet. Can the epilogue language? Okay, so and okay, so I just got an email from so Andrea, if you can private message me what email you're sending it from, because I just got an email. This could be yours, but it doesn't have your Facebook name on it. So anyway, okay, Joan, can that epilogue language? So tell you what, let's bring it up on the screen. Epilogue language, that's the one I want, and we go to that one. Can this be interpreted in any way other than as an attempt to impose Medicare Advantage regardless of any other process? Joan, thank you for your question. Section 101 is the governor's proposal that Delaware moves towards Medicare Advantage starting January 1st of next year. I think that's the only way to interpret that. Is an attempt to impose Medicare Advantage regardless of any other process. No, I don't think that's a fair interpretation. The interpretation I think that's fair is the governor is recommending that Medicare Advantage be imposed on retirees as of January 1st of next year. It does not say anything about stopping any further deliberations. All it is saying is that his proposal, it's just a proposal, his proposal is that we move forward with change to Medicare Advantage by January 1st of next year. So I think the first part is fair to say that. I don't think it's fair to say regardless of any other process. Yes, I understand that notwithstanding any provisions of the law to the contrary, that the first 9 words or so. That's just how things are worded in epilogue language. And frankly, a budget can't be, this if it happens this way, and otherwise then this, and if not, if A can't happen because of condition B, then we're going to do C, except if condition D occurs, then we're going to do E. A budget has to say, this is how we're going to do things next year. Governor Carney chose this in section 101, put it in there. This legislature has 5 months to look at it and decide how it wants to go. Not just the government or teachers union too lost trust. I think it's, so I'm going to keep jumping around because we're up on the screen there. That's not the one. That's the one. If you are a member of one of these unions, for current employees, again, I believe that Mr. Emsley is a representative of the, I'm not sure it's a union, but the Association of Retired School Employees. If you have a differing opinion, if you don't think that he knows of your views, I'd suggest you reach out to him. Frankly, you have emails for everyone here. If you want to share your views with any individual members of the advisory committee. That's why this information is out there in public. So Jane, response for that. Madison, sorry. Okay, so I'm going to get rid of that, and I'm going to check. Oh, DSCA, gotcha. So I have no email. No email from Madison 1. Ooh, yeah. So I gotcha. Andrea, the last email I see from you was back in October. I will check, junk folders, but I didn't think I was getting stuff into junk folders. Let's see. No, it's not coming through. I'm very sorry about that. I will send you an email if you can reply to that. Maybe that's the best way to get it done. And Jane, thank you on that. So I'm going to go back to this. Okay. That's fine. I feel like I'm wasting people's time on this, but I really want to make sure I get an email from Henry on this. Yeah, so Henry, if you can just do a reply to the email I just sent to you with your comments, that presumably will come through as you've wanted to do, and it just keeps not working. All right. Anything else here? Just okay. So at a minimum, the epilogue language signals the administration is still committed to imposing Medicare Advantage on retirees with no options, totally disregarding the high level of disagreement that is generated. I don't see any factual errors in that statement, Jen. That said, the governor signed into law Senate Bill 51 that established the Retiree Health Benefit Advisory Subcommittee. So hopefully he and the full administration is fully in support of us beginning this deep dive into all the options and making recommendations. We'll see. Thank you all. If there's no other questions, I want you to thank you for your time. Again, I don't expect to have another live one next Sunday, probably the Sunday after that. And I will try to email when there's updates. Certainly update things on my Facebook page when there's, for instance, any meetings announced for the Retirement Health Care Benefit Study Committee. Yeah, there we go. Advisory Subcommittee. All right. Thank you all again very much. Have a good week, and thank you for the good wishes. Well, hopefully I'll be much better in 2 weeks, and we'll see. I'm hoping to get down to Dover the week after the surgery and just be pathetic but present and doing my job down there. Take care, everyone.